everyone. I'm John Hammerly with the Plastic Surgery Channel, and I'm joined by my really good friends, Dr. Pat McGuire and Dr. Brian Brzowski. Where does this report find you guys? Brian, where are you?
I'm in Ogden, Utah, a small town just north of Salt Lake City in Utah.
And Pat?
St. Louis, Missouri.
And just to show you that we're an interdenominational, intercoastal, intertranscontinental area, I'm from Flagstaff, Arizona. That's where I'm living right now. And Arizona happens to be the first state in the union that has passed what some call a patient consent checklist for people who are interested in getting breast implants. Pat, fill us in terms of what the intent of this law is.
John, you and I were both at the FDA device hearings in March of 2019. And there we heard some very compelling testimony by women who had breast implant associated lymphoma and other women who have a variety of systemic symptoms that they associate with their implants. And one of the themes that we heard from those patients is they felt they had a lack of informed consent. Prior to their surgery, they felt like they hadn't heard all the potential risk associated with implants, and they received these long 30, 40-page informed consent documents that with all kinds of fine print that they really didn't go through to the level they should. And one of the things they had requested was a more concise, shorter, easier to understand checklist to start as a reference point for the full consent document.
Brian, sounds like a good idea.
Well, certainly a more educated patient and a more informed patient is always going to be a better patient. So sounds on the surface like a fantastic idea.
But maybe the devil is in the details. Pat, where do you think this law and maybe others like it? I understand that there could be at least 12 to 15 states that are considering the same type of legislation, including maybe something on a national level. Where does a law like this go too far?
Well, I think it's a good idea to have a checklist, and it needs to be for the patients to see the most important, the most common potential complications or potential side effects of medical devices. It needs to be somewhere where patients can see it. There are a few things in this checklist that I think kind of distract from the important points. There's one part that talks about specific results from studies done by two of the manufacturers. They did not complete their studies, which is important information for patients to have. But I think what's missed there is all implants have been reported with potential complications. You don't want to get into a distraction of one manufacturer over the other. The other one is talking about potential problems such as systemic symptoms that patients develop. They also talk about specific diseases reported in patients with implants, and reporting doesn't not necessarily mean cause. It can just be they happen to occur at the same time.
Somebody getting an implant that reports a disease might very well be the same as a person without an implant reporting the same disease.
That's exactly right. They talk about multiple sclerosis, polymyositis, which, yeah, I'm sure occur in women with implants, but those are in very small numbers. There have been a couple of studies. There was the large post-approval study review by the group at MD Anderson, which showed a potential association between systemic sclerosis, rheumatoid arthritis, and Sjogren's syndrome in implants, but it was a flawed study. It was patient reported data. They had two different protocols that were combined into one study. The follow-up was terrible, only 20% in the long term. So we have to look at all of the studies, not just cherry picking of data from a couple of studies that have some specific results.
Brian, you're a little concerned about some overreach.
Well, certainly, you know, I consider the physician-patient relationship to be one of the most sacrosanct relationships in all of the world. And so when I begin to see legislators and politicians begin to insert themselves within that relationship, it always causes me some concern. But I do think there has been an overall lack of uniformity in the decision-making process, hence the FDA's concern and our own interest amongst plastic surgeons to try to make that a more standardized process so that the patients are across the board getting all of the appropriate consent information, and they understand exactly all of the realistic things that need to be considered. And of course, that's where I start to get a little bit concerned when there's enough overreach in lumping in all these different diseases and disorders that have been reported, and Lyme disease being another excellent example in that report that Pat mentioned, that there's not an association necessarily just because of the existence of those two conditions. And I just want to make sure that the patients understand that what's appearing in some of these documents and in these rules isn't necessarily the latest and greatest medical information, and that we have a responsibility going forward to contribute to this process to make sure that that really is the thrust of the effort.
It sounds like from both of you, what I hear is that this checklist, while well-intentioned, might turn out to be a 50-page checklist.
Yeah, that's the big concern. When the complaint that we heard when we were at the FDA hearings was, 40 pages of small print does not lend to a good informed consent. And the checklist is not meant to replace full informed consent. It's meant as a starting point for a patient to take back to their surgeon and say, hey, wait a minute, there are patients who've had systemic symptoms or autoimmune diseases. What should I know more about that? And I think a checklist is great as a starting point, but not to replace full informed consent.
Brian, you agree?
Yeah, I agree, absolutely. And I think if that initiates that conversation with the patient's individual plastic surgeon, it can't do anything but help the overall process and outcomes for both physician and patient alike.
I think Brian made a really good point before in that talking about the informed consent between the patient and the physician, there has to be uniformity across, the country. And if someone has a physician who doesn't go through this process, I think a checklist to make sure at least the most important factors are discussed before and giving some uniformity to it, I think is a really good idea. But it just depends on what's in that document. And we don't want this to become another long document. We want this just to be the starting point of the conversation.
You don't want this checklist to be like the legal mumbo jumbo. You see it before you start reading something, you've acknowledged this, I agree, and there's no way you've read the 50,000 agate type print words that it goes along with the precursor of any type of warning.
Right. And John, I would say, I think the biggest struggle we're going to have, and Pat highlighted that already very well, is that we don't want to turn this document or these checklists into just one more medical legal contract that we're obligated to provide patients because of fears of lawsuits or litigation and things like that. This is a genuine need and should be an altruistic effort on everyone's part to truly educate the patients about the important decisions that they need to make. And we don't want to just turn this into some other 50, 60-page document that is of no value to the patient.
Excellent. Dr. McGuire, Dr. Brzowski, thank you so much for your time. I really appreciate it. If you have any more questions about this or any other issues regarding plastic surgery, you know where to go because you're right there, theplasticsurgerychannel.com.